Thank you, Mr. Speaker, and I thank the gentleman from Texas for yielding. Our nation is experiencing a deadly opiate epidemic, an epidemic that knows no boundaries and destroys lives, families, and communities. Today, 58 babies, one baby every 25 minutes, will be born suffering from the same pain adults describe as the worst pain of their lives. It is the pain of drug withdrawal. Neonatal abstinence syndrome, or NAS for short, occurs when babies are born dependent on opioids, and it is one of the chief causes of the significant surge of newborns in neonatal intensive care units across the nation. Over the last decade, the number of infants born dependent on powerful drugs has grown nearly fivefold. In states like Massachusetts, NAS is occurring at a rate 3 times the national average. NAS births are 5 times more costly than healthy ones. Costs have risen to more than $1.5 billion a year, 80% of which are paid for by Medicaid. Because of the skyrocketing rise of NAS cases and costs, doctors are desperately trying to find the most effective method of diagnosis and treatment. But there is little coordination of data and best practices and protocols among states, healthcare systems, and practitioners. And no medications have been approved by the U.S. Food and Drug Administration for treating these babies. The Protecting Our Infants Act is the first federal bill to take proactive steps in addressing the rise of NAS. With broad bipartisan support in both chambers, this is an opportunity for Congress to make a difference for babies suffering from opioid exposure and the families struggling with addiction. This bill directs the Department of Health and Human Services to develop the protocols for treating and preventing NAS. The Protecting Our Infants Act helps babies suffering from opioid withdrawal by making sure they get the best care available. This act will ensure that every hospital has access to the best practices and that states have the public health data they need to address this crisis. This is good for families, good for our healthcare providers, and good for our nation's bottom line. I want to thank my colleagues in the House, and in particular, Congressman Steve Stivers, for his partnership in this bill. I'm grateful for his deep commitment to addressing this problem and crafting a solution. I'm also grateful to Senators McConnell and Casey for sponsoring this legislation in the Senate. Today, we have a chance to help the youngest of those suffering from the opioid crisis. I urge my colleagues to pass the bipartisan Protecting Our Infants Act, and I yield back.
The gentleman from Texas is recognized.
I reserve the balance of my time.
Gentleman from Texas reserves. The gentleman from Texas is recognized. Kentucky is recognized.
Thank you, Mr. Speaker. I would like to yield 5 minutes to my friend from Ohio, Mr. Stivers.
Gentleman is recognized from Ohio for 5 minutes.
Thank you, Mr. Speaker. I rise today to support a bill that my colleague, Representative Catherine Clark from Massachusetts, and I introduced, H.R. 1462, the Protect Our Infants Act. I want to thank Representative Clark for her leadership, her hard work, and her commitment to protecting America's children. And this bill has the support of 95 bipartisan co-sponsors. It's a targeted effort to address a national epidemic of babies being born addicted to drugs. Recent data has shown that this issue, called neonatal abstinence syndrome, is sadly on the rise throughout the country. A baby is born with neonatal abstinence syndrome every 25 minutes, and its symptoms can last for months and lead to weeks of hospitalization and have a lifelong impact. A report by the Journal of the American Medical Association showed that the number of newborns diagnosed with NAS tripled from 2000 to 2009. In my home state of Ohio, the rate of neonatal abstinence syndrome grew over 600% between 2004 and 2011. It's taken a heavy toll on Ohio's healthcare system and Ohio's families. Treating newborns with NAS was associated with over $70 million in charges and approximately 19,000 hospital stays, and that was back in 2011, and it's been on the rise ever since. This issue is especially devastating to our families and especially devastating to the youngest among us, the babies who are born addicted to drugs. I recently heard from a grandmother to 3 babies who were born with NAS. She was pleading for help for her innocent grandchildren, and she wanted to make sure we did something about this terrible disease. I'm proud to say that the response in my district has been strong to our bill. There's a healthcare system called Adena Medical Center in Chillicothe, Ohio, and they actually have an incredible program which was piloted with a bunch of OBGYNs, and they started with just 15 pregnant women who were addicted to drugs, and they have served those women, and now they're on their second class to try to get those women off of drugs before they deliver. I'm happy to report that because of the support of the Adena Health System, none of the women in that group delivered a baby with NAS. Due to the success of the pilot, there's a permanent program that is starting now, and it already has a wait list. So I'm really excited to say that there are people out there showing real leadership. Last week, I hosted my 4th annual opiate roundtable in my district to bring together a lot of issues, and we talked about this bill and how important it was. So I'm so proud that it's on the floor today. Mr. Speaker, I urge all my colleagues to support the Protecting Our Infants Act, H.R. 1462, to help our nation's most innocent citizens. Thank you so much. And again, I want to thank Catherine Clark for her incredible leadership on this bill and her commitment. I yield back the balance of my time.
The gentleman from Kentucky is
I reserve.
recognized. The gentleman from Kentucky reserves. The gentleman from Texas
Mr.
is
Speaker, we have
recognized.
no other speakers. and
No other speaker.
ready
Prepared to close.
We close. We encourage our colleagues to support this bill.
The gentleman from Texas yields back. The gentleman from Kentucky is recognized.
Thank you, Mr. Speaker. During the hearing on the Energy and Commerce Committee, one of the physicians testifying, the neonatologist, turned out practiced with my first cousin, so I got to do research further into what's moving forward in this bill, and so I learned even more from personal stories about how important it is and how critical this is and how sad it is for children to be born addicted and how the opportunity is for us to help. And I certainly appreciate my friend from Massachusetts, Ms. Clark, my friend from Ohio, Mr. Stivers, and I would encourage all of my colleagues to vote for H.R. 1462, Protecting Our Infants Act of 2015, and I yield back my time.
The gentleman from Kentucky yields back the balance of his time. The question is, will the House suspend the rules and pass the bill H.R. 1462? Those in favor say aye. Aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative, the rules are suspended, the bill is passed, and without objection, the motion to reconsider is laid on the table.